The movement of hospital services to private clinics are expensive and dangerous and will result in higher death rates. Ontario must reconsider its plans and stop the dismantling of our local hospitals and the contracting out of hospital care to private clinics. It will lead to smaller community hospital closures and open the door to corporate delivery of these procedures. With the recent announcement that the Renfrew Hospital plans to cut birthing and obstetrics services, Eastern Ontario hospitals are quickly becoming ground zero for health service cuts in Ontario. Downsizing hospitals, cutting beds, and shedding services is the basis for the provincial Liberal government's healthcare delivery reforms. Small rural hospitals are particularly threatened under this plan. The Renfrew Victoria Hospital plans to close its obstetrics unit in June 2014. The closure comes following significant bed, surgery, procedure, and therapy cuts at neighbouring hospitals in Arnprior and Perth and Smiths Falls. Ottawa too will see thousands of procedures moved from the Ottawa Hospital and privatized to private clinics, some of them for profit. Short of closing hospitals as is happening in Niagara, it appears that Eastern Ontario is seeing the harshest cuts to hospital services than elsewhere in the province. Cutting obstetrics is particularly, communities need both the young and the old to stay vibrant. If young families can't access health services including birthing at the local hospital, they will not be moving to Renfrew. Cutting hospital services is not a way to build and grow the community. It is the exact opposite of what Renfrew needs. If this cut happens, there will be no babies unless born at home with Renfrew as their birthplace. And that is such a loss. At the Arnprior Memorial Hospital, 6 hospital beds have been closed and destaffed since early summer 2013. There are plans to cut more services in physiotherapy and diagnostic imaging, which will mean longer waiting times for area patients. In Perth and Smiths Falls, the communities have formed a local coalition, which has been actively fighting the closure of 12 hospital beds and cuts to hip, knee, and cataract surgeries, the day hospital, palliative care, physician recruitment, and non-emergency surgery. Studies clearly show that private delivery of healthcare is more expensive, while, ironically, providing inferior care and higher death rates. Ontario must reconsider its ideological bias towards private sector delivery. Superior patient care outcomes are provided, much more affordably, through public delivery. Please get involved and support the Ontario Health Coalition in the battle against private clinics. Surgical and diagnostic services belong to community hospitals with highly controlled standards, proper policies and procedures, properly trained staff, and the ability to deal with emergency situations. Community hospital plans for the unpredictable.